have a lot of patients that either have addiction of some type, or they're coping with their loneliness or coping with their mood problems, depression, or their PTSD using medications, self-medicating with drugs and that type of thing. As I think most of you, or probably all of you know, that recognizing that this is not necessarily a positive way to deal, addiction is not necessarily a positive way to deal with that, is one of the first steps. If an individual can recognize, for example, that they're addicted to, or overusing drugs and alcohol, and that they need to address that in some way, then one of the most effective ways that's done is still through groups, such as Alcoholics Anonymous, Overeaters Anonymous, which is also seen as an addiction for many, Narcotics Anonymous, and the fundamental core of that is with groups, and those groups are often virtual now, and people set up with a mentor and a buddy and those types of things. If they're not at that point, then there are a number of tools that can be used to try to help them become aware or fill out the information about whether addiction is the key problem, and help them gain insight into that. One of those is the cage questions, as I think you're familiar with about one of the fundamental questions in that is, do you feel like you need to cut down? Do you think that maybe you're overusing a particular substance in those areas? I'm not sure what kind of addiction your patient has, but that's a way of sort of opening up the dialogue and the discussion in that. I don't want to be too gender biased here, but my experience is that men especially tend to be more reluctant and less skilled at creating the kinds of social links that we're talking about and social connectivity that we're talking about. And so they have to find a way to help them be comfortable in these areas. For many of the men who have been reluctant to reach out, to make social connections in these areas, often I would start with journaling, because journaling is a way they can begin to reflect internally on this area, and then I'll just ask them, have they journaled about this? I had a man with a number of addiction problems, refused to go into mental health. He had PTSD, depression, etc., was very isolated. We started with, he had major adverse childhood experiences that he had not addressed. He began by journaling to himself, and as he did that over the weeks, he felt more comfortable talking about it or thinking about it, and at some point then was ready to go and actually see a counselor about it, to open it up with somebody else. So, easing people into this problem, using screening questions to help them become more aware or determine the seriousness of the issue, and then using self-care techniques that aren't treatments per se, but they are ways to enhance wellness, enhance connection, and enhance awareness, are the approaches that I